No, from those, which one is the best?
Maria Ochoa de Gonzalez is a 74-year-old housekeeper in El Cajon. She says she wants a COVID-19 vaccine, but doesn't know how to get one.
The doctor wanted us to go today, but since I had this appointment, I said that we call him back. I don't know who called us.
Access issues like hers are playing out across the county. Lower income areas with high COVID-19 case rates, such as Logan Heights, El Cajon, and Chula Vista, have low vaccination rates. Meanwhile, wealthier areas with low case rates have the highest vaccination rates. In places like Coronado, Rancho Santa Fe, Del Mar, and La Jolla, at least 1 in 4 residents have received vaccines. This disparity stems from the way the system has been designed, says Rebecca Fielding Miller, an epidemiologist at UC San Diego. For example, vaccine appointments are, for the most part, only offered online.
It's hard to access these websites. It really is. You needed access to the internet. You needed to be comfortable if you were at Petco with a form that at least asked you your social security number, even if you could just put in all zeros. And you needed to be pretty quick and anecdotally, and you needed to be pretty tech savvy.
After healthcare workers, older people have had access to the vaccine first, and that population is generally whiter and more well off. And so far, vaccines aren't available through the health networks many people of color use, even for those over 65.
Some of it is I can't take time off work to go sit at Petco or my doctor's office or a superstation for hours. The only time that was available is a time I have to work, and I can't take that 3-hour block. That's possible. I don't have a private car, and I'm concerned about taking public transportation. The perceived benefits of running those risks or outweigh what the actual barriers are.
The problem is we have too many people who want vaccines.
Assemblywoman Lorena Gonzalez says it's crucial that racial and economic divides be addressed before vaccinations are opened up to more age groups and professions.
Because if we move on too quickly, those folks are going to continue to stay unvaccinated. Those barriers don't go away by opening it up to teachers and police officers.
Vaccination sites are now open across the county, and many have hundreds of appointment openings every day. But that doesn't mean people in South Bay or East County have ready access to a vaccine, Gonzalez says.
However, what happened is when they went online, individuals with more resources and capabilities took those vaccine appointments. So we had a ton of people coming from, North County down to Chula Vista.
Organizations such as the Chicano Federation are now working with the county to help people schedule and get transportation to vaccine appointments. Nancy Maldonado is the Chicano Federation's CEO.
We have dedicated staff that is helping people on the phone and in person to schedule those vaccine appointments all day, Monday through Friday, to schedule the vaccine appointments, but also to ensure that they have transportation. And if they don't, to help them find transportation, making sure that they have childcare.
They are also employing community health ambassadors known as promotoras. They station themselves outside grocery stores and other community locations where they talk to people about their concerns and help them get vaccine appointments.
We are seeing a very small increase in the number of Latino people in the county who are getting vaccinated. It's increasing slowly, obviously not at the rates that relative to the population, but we are starting to see some movement. So, to your point, hopeful that once all of these efforts get underway, that we'll start to really see that percentage increase.
Claire Trageser, KPBS News.